Do you have PCOS and are you trying to get pregnant? And are you frustrated with getting dismissive fertility advice from your doctor, like, oh, just lose weight and everything will happen? Or come back when you're ready to go through an IVF cycle. And that just doesn't sit right with you. Do you want to get to the root cause of your fertility struggles and turn those around so that you feel healthy and you also have the best chance at getting pregnant? If that's you, then this podcast is for you. Welcome to the PCOS Fertility Health Podcast. I'm Dr. Angela Potter, a PCOS fertility expert, helping women like you turn around their fertility struggles so that you can build the family of your dreams. And today I am thrilled to have a special guest on the podcast. I am joined by Dr. Ami Patel. She is a holistic pharmacist. Dr. Ami, while she's working behind the counter, putting these medications together, she is an expert in pharmacology and how these medications are working. She is also an expert in understanding the power of lifestyle changes and supporting the body in a holistic way to support your symptoms to turn around and for you to be supporting your PCOS. And so she's going to be talking about the medications and also the power of lifestyle and how those two weave together for your PCOS journey. Before we jump into that special interview with Dr. Ami, I want to be sure that you have the special gift that I have created for you. That is the PCOS Fertility Checklist. And that is a simple download, which is going to give you step-by-step a checklist with important markers that you need in order to have a fertility plan that's going to help you create optimal fertility health. So if you haven't gotten your free gift yet, then head on over to drangelapotter.com/checklist. And now let's dive into that conversation with Dr. Ami, holistic pharmacist. Dr. Ami, welcome to the PCOS Fertility Health Podcast. I am thrilled to have you here today.
Thank you so much for the opportunity. I'm excited for our conversation.
Yes, I think that this community is going to get such value out of what you have to share because you have this really unique set of skills. You're a pharmacist, but you have this holistic side to what you do in pharmacy. Can you tell us more about what it is that you do?
Yes, definitely. Professionally, I am trained to be a pharmacist, but also I bring in holistic aspect of lifestyle changes to help my clients manage their PCOS and fertility. And so what I focus on with that is things like mindset, nutrition, movement, sleep management, and stress management, because ultimately all of those things go together, and there is a time and a place for medications, but most of the time it has to be combined with the lifestyle to get the best benefits from it. And then if you just take the medication, once you stop it, if you don't improve your lifestyle, then whatever symptoms you're trying to overcome will still be there.
I love that. This is such a good, juicy topic. So you, the pharmacist who is, day in and day out, like they're working with all these medications, like this is what you're seeing, that the lifestyle piece of that has to get worked in order for the medications to do what they're supposed to do or for people to see the best results. Is that right?
Yeah, that is it in a nutshell. And so many times, like clients come to me and they're on supplements and medications, and I help optimize it because, first of all, there's only so much your body can absorb. And second of all, you can't out supplement or out medicate a poor lifestyle. Like, it's just not possible. And so I help with like optimizing that, making sure it's like you're just taking what you need to take. And also, it's a waste of money, honestly. Like, you don't even know what's going to help if you're taking like 5 to 10 supplements or medications. Like, you don't know what's working. You don't know what to keep up with long term. It's not a good use of money, and it's not really the best for your body, right? There could be interaction, side effects. So I help with optimizing all of that too. And like if someone wants to transition off those medications, like birth control and stuff, I can support you with that too.
And there's a bigger risk, I think, than people realize when taking supplements with medications. because
Hmm.
supplements being over the counter right now, it's so easy to be like, oh, I heard about this nutrient. I'll just try this and try this. And of course, women with PCOS, and particularly in this
Hmm.
community who want to get pregnant, there's that deep desire to see changes. And so it's easy to grab supplements. But what a lot of
Hmm.
people don't understand is that even though they're natural, they can
Hmm.
interact with medications. Do you see that with people that you're working with?
Yeah, that's a good point. And yes, I'm so glad you brought that up. Like, just because something is natural doesn't mean that it's safe or it doesn't come with its own risk of side effects and interactions. And like, for example, sometimes somebody could be on like insulin or metformin, but there's other supplements as well, like berberine, that work similarly. And if all of those medications are combined, it could lead to things like low blood sugar. So you just have to be careful and understand that, there are prescription medications and supplements, but you want to make sure that you're not increasing your risk of these negative side effects.
Yeah, I love that. That's important for people to take that
Hmm.
away. So I would love to hear from you, as you're training in general pharmacy, what was it to lead you be interested in the holistic side, lifestyle, mindset, all of this? What were you seeing or what was happening in your own, journey that led you to incorporate that into your skill set?
Well, yeah, it's funny because I used to be one of those people that used to be on 10 supplements. Like I have PCOS as well. And with my journey, I was one of the people that was like, okay, I'm going to take all these supplements because that's what I need to do, is what I thought. But I was the one myself initially struggling, like, what medication or what supplement is helping me? And like, do I have to take this for the rest of my life? I don't want to do that. And then I realized that I really need to implement the lifestyle changes with it. And that's when I saw myself the most results, because prior to that, like I was taking birth control and I kind of blindly followed that advice for 7 years because I didn't know any better. And, despite being a pharmacist myself, like we didn't learn about birth control in depth. We didn't learn about PCOS in depth in pharmacy school. And my providers told me that like I need to be on birth control. And so I did that for 7 years. And then at that time, I started having symptoms again. I was getting acne, I was losing hair, I was like had difficulty losing weight, mood swings, all the things. And I was like, this birth control is not helping me anymore. And I tried to once again get help from the Western healthcare system and be like, hey, like, are there other options? Because this is not helping anymore. And the only things that I was told is, well, like, why do you want to come off if you don't want to have kids? Or like, just take like metformin and spironolactone. And I'm like, okay, but there has to be like other things I can do because these medications, they're just helping with the symptoms. And once I come off, like, I know the symptoms will come back. And once again, I was not really getting the best answers. And that's when I was like, okay, I need to see what I can do myself with trial and error with my lifestyle to improve my symptoms. And then that was like a whole journey for, a couple of years. And then I finally got the hang of it. Like, hey, for my body, I know, and for my PCOS, that these are the things that I need to do to help manage my symptoms. And then like basically decreased the supplements I've been taking as well to like two of them basically. So yeah, that is the journey. And then that's what I see as well, with my clients. Like I mentioned, a lot of them come in with like 10 supplements they're taking, and we help reduce that, optimize what they need, and what will support them with their lifestyle.
That's so great. So then within that journey, like now you're supporting, you work as a pharmacist and then you also support women who have PCOS in this doing
Yeah.
exactly what you were just describing, like helping really
Yep.
streamline their needs.
Hmm. Yeah, it's like building the foundation of the lifestyle, right? Like understanding that, basically helping individuals understand their body and their PCOS, because everyone's PCOS is different. Things that
Mhm.
help one person may not help the most for another person, but it's understanding your body in the 5 areas that I talked about, like optimizing your sleep, managing the stress, the nutrition, the movement aspect, and the mindset aspect into that as the foundation. because as we go through different phases in life, like some of those things may change. Everything impacts our hormones. So it's like understanding at a foundation what your body needs.
That. So there are a few really common medications used for PCOS.
Mm-hmm. Mm-hmm.
Metformin being one of the top, birth control, as it's being used to regulate periods, right, for PCOS. And then the ovulation induction medications. What are some misconceptions that you see that people have about these medications and in their fertility journey?
Yes. So first, let's start with birth control because you said that it's used to regulate periods, but I want to clarify that the way birth control works, and in the name itself, it says like birth control, so it's to prevent birth. And one of the main things in our menstrual cycles is ovulation that's needed for conception. And so if the medication prevents birth, then it prevents ovulation. And to do that, basically, the way the birth control works is it stops your natural hormone production and you're taking synthetic hormones that kind of mimic a menstrual cycle, but it's not the full four phases of the menstrual cycle. It's just synthetic hormones that help you kind of go through three of the phases. But since it's synthetic hormones, you're not really getting all the benefits of our natural menstrual cycle, which, that I'm sure you have podcast episodes about that, and that could be its own conversation. But the major takeaway with the birth control is that it can help improve symptoms of PCOS because it can like decrease testosterone production, and that can help improve symptoms like the acne and hair loss and things like that. But when it comes to our menstrual cycle, it's basically shutting down our natural hormone production, and we're taking synthetic hormones with birth control. And that's the oral birth control. I mean, there's some like IUDs that you can still ovulate with, but that also is a different conversation. But yeah, does that kind of summarize the major misconception?
Yeah, that's great. I think a lot of people aren't quite sure because they're being recommended
Mm,
birth control by their providers, and they're just following that advice. But like in their minds, they're thinking,
yeah.
why am I on birth control if my goal is to get pregnant? And that can be really confusing, which honestly, I think it's right to ask
Mm-hmm.
those questions like, why am I on this? And what is it actually going to help me with my periods?
Yeah, and this is sometimes I don't want to say that like, medications are bad, and there's a time and a place for it. So if you want to take
Yeah.
birth control, it's just understanding that, hey, like what is it actually doing? Because you want to understand how it actually works. You should ask the providers what the side effects are and have a goal like, hey, I do want to get pregnant later. So what is the time frame that I need to come off of the birth control? And you can like someone can still use birth control for like say a year, for example, like or a couple years, and it's like you can use the medication while you make the lifestyle changes, and then once the lifestyle changes are there, you can slowly transition off of the birth control, and that can support you with getting your periods back naturally to get ready for fertility. But it's about asking those questions because you don't want to get to a place where it's like, hey, we want to like try to conceive, and then you just come off the birth control a month before, because there's like with birth control, sometimes you can have vitamin deficiency, so you want to make sure your body's optimized for conceiving, and then just understanding your natural cycle, knowing when you're ovulating, because if the lifestyle changes aren't made when you come off of birth control, whatever symptoms and however your cycles were beforehand is how they will be after, like whether they were super painful or irregular.
Mhm. Well, thank you for sharing that. I think that'll be helpful for people who are on it and thinking
Yeah.
about that timeline. How about metformin? Metformin is, probably from what I see, the top most talked about medication when it comes to PCOS. What misconceptions with metformin are you seeing? And do you see that people are getting the results that they're looking for all the time with metformin?
Yeah, so metformin is primarily used for insulin resistance, and it's originally prescribed for type 2 diabetes, which at a baseline has the concept of insulin resistance as well, which is what contributes to one of the things that contributes to PCOS. And so the way that metformin helps with PCOS is that it improves insulin resistance, which therefore improves, like, decreases testosterone levels and helps with leading to like balancing your hormones because the insulin and the testosterone get reduced. So similarly to birth control, there is a time and a place for it. And, once again, if somebody wants to take it, you can take it, but if you don't make the lifestyle changes that are contributing to the insulin resistance, then that level of insulin resistance can come back after coming off of the metformin. Some of the misconceptions is that like it's like an official treatment for PCOS, but it's not. It's really for diabetes, but it's used for PCOS because of the insulin resistance aspect, and it can be beneficial, but once again, you can't like out medicate a poor lifestyle. So you can take a medication that improves insulin resistance, but if you're still eating, for example, like lots of processed foods that are high in carbs, then there's only so much a medication can do. And if you're not exercising, then there's only so much the metformin can do. So yeah, there is a time and a place for it, but the philosophy that I believe in still applies to all the medication.
Yeah, I mean, I think for you who is listening right here, that is a big truth bomb that Dr. Ami has dropped twice now, that you can't out-medicate a poor lifestyle. That's huge. And, I think our mentality just as a culture, we really have
Mm-hmm.
embraced this for a while now. And is this idea that there's, one pill out there that's going to fix everything.
Yeah.
And when it comes to fertility or for many other, medical issues, that's not
Mm-hmm.
what happens, right? And so thank you for bringing that to our attention.
Yeah. And like if you have a broken leg, you need crutches and a cast to heal it, right? Like you can't just
Hmm.
walk around with a broken leg. And so I kind of explain the concept of medications that way. Like maybe you do need to be on the medication just for a little bit of time, 6 months to a year, to kind of help your body. If you can't function and you need the medication, then that's fine, take it. But just ask the questions that, okay, what are the side effects and what is the plan for me to come off of it? And do I need to be on this like my whole life? And those types of questions.
Yeah, I love that because it's certainly not that these medications are bad. Like we also
Yeah.
live in this time and age of
Mm-hmm.
advancements in medicine that's really quite amazing.
Yeah. Yep.
And
Yep.
but that's a really wonderful like metaphor to talk about using it. Like when you break your leg, you do need those crutches, but it's only
Yeah.
for a set
Yeah.
period of time.
Yeah. And I really like to emphasize that with like, mental health as well, because sometimes if you have so much anxiety and depression and you can't function and you don't have the energy to exercise, you don't have the motivation to plan your meals out, right? You're sleeping too much or you're not sleeping, then okay, maybe you do need, the medications to help you out, to help you get back into making those lifestyle changes. So there's a time and a place for it, but as an individual, I think it's important for you to understand that, like, why am I taking this medication? And does it fit with how I want to manage my health and what are the side effects?
Yeah, I love that question. That's really thought provoking. Like, does this fit in with how I see my health, or
Yeah.
I forget what exact words you just used there.
Yeah.
But
Philosophy of how I want to manage my health. Yeah.
yes, yes. And, certainly some medications are like, no, like this is necessary, but I will say with PCOS and fertility, a lot of the medications, they aren't 100% necessary, right? As we've talked about, or you mentioned the
Hmm.
metformin, it's for diabetes, which responds really well to lifestyle changes.
Hmm.
So some people that having that medication on board that fits really well. And for other people, they might think, well, no, I want to try some other changes before,
Right.
I see that in the toolkit, but I don't want to use it quite yet.
Yeah, exactly. Yep. These are
Mm.
all just tools and understanding what tool you need when you need it and how long you need it for. Yep.
Yes, yes, yes. How about the ovulation induction medications like
Hmm.
letrozole or clomid? What misconceptions are you seeing with those?
Yeah, that's a good question. I mean, so ovulation medications, the way they work is they help somebody's body induce an ovulation. So in our menstrual cycle, we have like the period, then we go into the luteal phase and ovulation, then the follicular phase. And the ovulation phase is basically when like the egg gets released from the ovary and is waiting to meet the sperm for conception. But if our hormones aren't going through all four of those phases naturally at the levels they need to, then our body may not ovulate. And so these medications help kind of push the ovulation along so that the egg and the sperm can meet. So that is how the medications work. Some misconceptions is that sometimes people think like letrozole is a chemotherapy medication, but it's actually a hormone therapy that's used for patients that have had like breast cancer because of the way it affects estrogen. But for the use of fertility, it kind of helps with increasing or managing those levels so that ovulation can be induced. And some other misconceptions are things like they always cause multiple pregnancies. That's not always true as well. And sometimes people may think that they can cause birth defects, but that's not true as well. So, and then those are, I mean, as you were saying, our technological advancements has allowed us to have these medications, which is great and fantastic, and we can use them if we want to and should use them if we feel like we need to. But also understanding that with these pregnancy induction medications, they can help you get pregnant, but you also want to stay pregnant, right? So this is once again where the lifestyle part comes in, right? Because yes, you can use the medication to get pregnant, but like to have a healthy pregnancy for yourself and the baby, there's still lots of lifestyle factors that go into that as well. So my thing is always like, okay, let's try to figure out why you're not having those regular periods and why you're not ovulating naturally, because one of the main hormones that comes from ovulation is progesterone. And progesterone is a really important hormone that's needed to maintain a healthy pregnancy. And if your body's not naturally producing that, then it's like, okay, let's figure out why. Because we can give you this medication and you can ovulate and you can get pregnant, but your body still needs to make that natural progesterone for the rest of the pregnancy as well.
I'm so glad that you brought that up. Yes,
Yeah.
because again, we get focused on those medications, like ovulating, like we want to see that ovulation happen,
Hmm.
which, yes, of course, right? That's one of the goals. But yeah, even if you ovulate and yet you don't have enough progesterone or,
Hmm.
all these different things that need to happen next can't happen for a variety of reasons, then getting that egg out of
Hmm.
the ovary, it's just like, okay, one step of the whole
Hmm.
process.
And
Hmm.
then with pregnancies with PCOS, there's high risk of like gestational diabetes. And that once again goes back to the insulin resistance, which I touched on earlier, that, you still want to try to improve that as much as possible through lifestyle, because then you can take insulin if you do end up with gestational diabetes in pregnancy. But you know, once again, it's like, but what can you do that's in your control with the lifestyle? Like, is there ways you can optimize more protein and fiber and healthy fats in your diet? Is there a way you can get movement in, even if it's walking or yoga or whatever you enjoy doing, right? It's like, how can those things be optimized so that you can maintain a healthy pregnancy for yourself and the baby. Even during delivery, there's like high risk of preeclampsia, which is high blood pressure, to a dangerous level for the mother and the baby. And premature births are common. So keeping all those things in mind, that like before jumping into like the worst case scenario, I would say, is like when somebody comes off of birth control and then they get diagnosed with PCOS and infertility at the same time. Because usually when people say they want to get pregnant, it's not like, it's usually sooner rather than later, right? It's like, okay, we decided we want to try to start having a family, but unfortunately then that time is not there to be like, okay, let me come off of the birth control, let me figure out like what my cycles are naturally. Okay, my cycles are like 45, 50, 60 days. Why is that happening? Like, what can I do to help optimize my hormones? What can I do with my lifestyle to improve my insulin resistance and decrease those testosterone levels? And for that, we do need some time because those things do take time to see the benefits, but they contribute to the long-term health that we're talking about as well.
I think some really nice kind of grounding points that you've said that people can, these nuggets that someone who's listening can walk away with is that, we've talked about this mainly with hormonal birth control, the pill, that you want to have an idea of your timeline to really
Hmm.
understand how soon you want to get pregnant, because you need some time to adjust the hormones and get your body ready. And then
Yeah.
also that concept of, you can't over medicate a poor lifestyle. Yeah.
Yeah. Yeah. Providers say that you should try for a year before, we like diagnose infertility and give you these medications. But,
Mhm.
sometimes people may jump into it because, but you don't want to just come off of birth control, not know how your cycles are, and then try to, induce the ovulation. And then, yes, you may get pregnant, but then, you want to make sure that you understand what's going on with your body and your lifestyle is optimized to maintain a healthy pregnancy for you and the baby.
Yeah, yeah, which you could be working on as
Yeah,
you're
of
prepping,
course.
like while you're on
Hmm.
the medication or the birth control.
Yeah,
Yeah.
yeah, yes, you can. You can do that. Yep, you can
Hmm.
definitely do that while you're on the medication and birth control. Yep.
Yeah, yeah. Dr. Ami, I know I'm not the only one thinking this, that I'm like, I wish that if I were going to pick up a medication, it was you behind the counter, the pharmacist, being like, here's your
Oh,
medication. And are you also doing some yoga? Are you also like going for a walk in the
yes,
mornings?
yes,
Like,
yes,
that's just
yes.
so refreshing to come from a pharmacist.
Yeah, I do get that a lot because people are like, but isn't that kind of against what you do? And I'm like, yes and no, because there's a time and place for Western medicine. And, as you said, it's so amazing that we have these advancements and we have these medications and resources and tools, but there's also a time and place for combining Eastern medicine and like a holistic approach to include those things. Because ultimately, like the medications, there can be like a cast and a crutches, right? Temporary. And we just want to feel better for our long-term health too.
Yeah. And it sounds like you have people who are coming to get medications from you, you have their best interests in mind, because when they are on these
Yeah.
medications, you want them to see those results and have that success. And what you've seen is that that's so important to pair that lifestyle.
Yes, exactly. Yep.
So, for people who are getting medications for their PCOS and their fertility, you know, how can they use their pharmacist as another
Mm.
person on their team? Or at least, what are some tips for when they're at the pharmacy picking up their medications? How can they best communicate with their pharmacist?
That's a great question. I'm so glad you asked me that because, honestly, I feel like, pharmacists, they don't get as much like credit or attention as
Mhm.
the role that they can play in someone's healthcare team. So yeah, pharmacist is a great person to ask questions to about like side effects of medications. interactions. You know, you can ask them that, hey, this is a new medication I'm starting. These are other medications I take. And you can also ask about supplements, because supplements, vitamins, there can still be interactions, and that's not always on somebody's like full profile of medications, right? Because you could just pick something up. Nobody has to know what you're taking. So it's always important to communicate that, hey, I also take like vitamin C or vitamin D, things like that. And you can ask them like, okay, what are the side effects? What are interactions with these medications and supplements I take? For example, like metformin and birth control, we talked about, actually does decrease vitamin B levels. And so you can, they would suggest to you that, hey, you get your vitamin B levels checked. If you need to supplement, you can supplement. You can ask how to take the medication, like, do I need to take it with food, without food? Any potential side effects you can experience from it. So yeah, those are some important questions. If somebody is using like fertility medications and injections, asking for support on like, how do I like use this medication? How do I use the injection? Do certain medications need to be separated from other medications when you're using or taking them? Yes.
Hey,
Those are
yay.
some of the things, yes, that can, yeah.
Yeah, good. Well, I hope you listening or jotting these things down so then you can use that next time you're at the pharmacy.
Yes,
So,
yes.
Dr. Ami, how can people find you? How can they be a part of your community and learn more about what you do? Please tell us.
Yes, thank you for asking that. I am active on Instagram at holistic.hormones.pharmacist. And then my website is dramipharmacist.com. So that's DRAMI pharmacist.com. And I also have a lot of free resources. I also have a podcast that you can also watch on YouTube or listen on Apple and Spotify. And then I also have lots of free masterclasses that I've done on like understanding PCOS, improving lifestyle. I do free masterclasses periodically as well as challenges. So you can find all that information mostly updated on Instagram, but also my website. And then I also offer a free consultation if you want more one-to-one support. And then we can work together on like 2, 4, or 6 month basis, because a lot of these lifestyle changes, it does take some time to see the benefits, but like you can start feeling better right away in terms of things like energy and improving your sugar cravings, but long-term benefits like improving acne or hair loss or optimizing your period, that may take a few months. So I have different packages for that.
Love that. Well, those links will be in the show notes.
Yes.
So for those of you listening, you'll be able to just get access over to Dr. Ami's amazing resources. Thank you so much for being here and
Yay.
sharing your expertise. Like, your wisdom is creating a ripple effect to support many,
Thank
many
you. Thank
women.
you. I really appreciate that. And thank you so much for the opportunity for me to come and have these conversations. I really love doing that. So, yes, thank you.
Oh, good. Of course. Dr. Ami gave us so many golden nuggets of information to take away from that conversation, didn't she? I hope you loved it as much as I love talking with her. And I hope you have these fundamental takeaways about some misconceptions about medications, about questions to be asking your provider when you're starting to take medications, and then also how to use your pharmacist as yet another important person in this fertility journey. I have all of Dr. Ami's links in the show notes, so please go check her out, go listen to her podcast, hang out with her on Instagram. She is a real wonderful woman who wants to be supporting you with your PCOS. If you are loving this podcast, you can leave a 5-star review over on Apple Podcasts. And as a reminder that this information is for informational purposes only. It is not meant to replace the information that you are currently getting from your medical provider. And as we wrap up here today, I want to remind you that if nobody else has told you this today, I believe in you, and I believe in your ability to turn around your PCOS symptoms, optimize your fertility, feel healthy, and have the best chance at getting pregnant. I'll see you right back here next week.